This episode of Ask the Doctors is being brought to you by the Wayne County Government. The Wayne County Health Department is holding a COVID-19 vaccination clinic this Saturday, March 27th from 11 to 5 at the former Elder Beerman site, 601 East Main Street. This will be a J&J only vaccination clinic, which is a one-dose vaccine. Dr. David Jetmore, along with State Representative Brad Barrett and his wife Mary Ann, will be part of the team giving shots. You must be an Indiana resident who meets current state eligibility guidelines to participate. Appointments are preferred and can be made at ourshot.in.gov, but walk-ins will be accepted. Thank you for joining us for this community update, a open conversation that we are having with some local doctors. My name is Eric Marsh. I'm Executive Director of Whitewater Community Television in Richmond. Joining me today, Dr. Thomas Huth, who is Vice President of Medical Affairs for Reed Health, Dr. David Jetmore, who is Wayne County Health Department Public Affairs Officer. Did I get all of that?
No, I was really disappointed in your delivery, Eric.
Were you?
It's Wayne County Health Officer.
Wayne County Health Officer.
Yeah.
Okay, I'm sorry. All right,
sure
we have to
you'll
start
do
this
better.
all over again. No. And we're going to spend the next hour not clowning around, but answering your questions. I've had a chance to talk to both of these gentlemen who have been incredibly generous with their time over the last few weeks. But it was important to them, actually, that they be able to provide the community some information. And the community in this instance is not just Wayne County. Reed Health is a regional health care provider feeding in a number of different counties. So I believe that we may be on down in Fayette County on CTV3. We are on Facebook Live, so if you have friends, family who you want to see this, you can find us there. We are taking your questions on our Facebook page. You can also send us a question through Twitter at WCTV Info, and we will get to as many of those this hour as we possibly can. And we are really interested in your questions. I have one that was sent in on this piece of paper that I have, and beyond that, I don't have one, so this could be a very short conversation. Let's get to this one, and then hopefully while you're answering it, we'll get a few more. This came in on Twitter yesterday afternoon. If the federal government decides to reopen America before healthcare experts tell us it's safe, what options are there for our community to continue to try and slow the spread of the virus? This is very similar to a question that Governor Eric Holcomb got asked yesterday at his press conference. It's one that I had a chance to kind of ask Mayor Dave Snow of Richmond when I talked to him on Monday. As you all have a chance to talk to the local officials, are they kind of driving this, or do you all feel like as healthcare professionals, you all are driving this conversation and they are taking the advice from you?
Well, I think, I would say, just speaking for me personally, that it has to be a dialogue, that it has to be the right balance of what's best from a clinical, epidemiologic, public health point of view, but also what's good for the state and the nation from an economic point of view, because it's certainly true on the one hand that we have to continue to utilize good practices and protect the most vulnerable people in our community, utilizing every reasonable step to do that. But on the other hand, we can't shut down the economy indefinitely over this, and we can already see some of the economic effects happening, large numbers of jobless claims coming in, and those are probably only going to multiply, business closures and such. And that has long-term negative consequences for people directly as well. So where that balance is, I don't know, but I believe strongly that the governor, the president, all our political leaders are trying to engage in a reasonable dialogue with the health leaders and figure out what's the right exact pathway to take that will, to get the economy rolling again, but also protect the seniors, particularly in our community, seniors and people with chronic health conditions who are most at risk from the complications of this disease. And to me, if the political leaders, the government leaders, decide that it's time to kind of and maybe in a phased fashion, get the economy rolling again, start opening some businesses, get people back to work, then what I think we need to do from a health care point of view is continue to, in a sense, reverse isolate the most vulnerable in the community. And I'm thinking of people like long-term care facility residents, where they're already the most buildings across the country are pretty much locked down and not taking visitors except for very urgent matters, and really have intensified their infection control practices. That won't change if the economy begins to open up. And then there are people who really should spend more time at home and still avoid going out into social circumstances for their own protection. Right now, everybody's trying to stay home to help prevent, say, the younger, less vulnerable from causing infection in the people who are most vulnerable. But, so I can sort of foresee a future where it may be in a phased way we're getting the younger, the working type of folks back into the workplace in some kind of a fashion, but still practicing good practices like social distancing and hygiene practices. And those people still have a responsibility to intentionally modify their behaviors to avoid, where they can, potentially accidentally contaminating or causing infection in people who are more vulnerable. And then on the other side of that, the more vulnerable continue to have to practice self-isolation techniques to protect themselves. That's sort of the way I see it playing out, but that's just my own personal view of the matter. And we'll have to see what happens. And Dr. Jetmore might have a different impression of things, coming at it more from a purely public health point of view. And so I'd be interested to hear his thoughts.
Well, this is bitter medicine that we're having to take in order to control this virus. And the decisions to close restaurants, the decisions to close barber shops, hair salons, these were not taken lightly, and they're difficult decisions. But I have to say, Eric, that our leaders here in Wayne County, the commissioners, the city council, the mayor, their decisions have all been guided by the public health department. All these difficult decisions, no one wants to shut down an economy, but the alternative is to let this virus rage throughout society. So I think at the present time, we're doing all the right things. In fact, we're doing almost everything we can, except, to bring the workings of our society to an absolute standstill. So we're doing the right things now, and I think that's bearing fruit. I think we're having a much slower growth of this virus spreading around than we've seen in other parts of the country, where people acted later than we did in Wayne County, and for that matter, the state of Indiana. So, but I agree with Dr. Huth, when we get to the point where the numbers are falling instead of rising, and we start wanting to open up our society and our businesses again, it needs to be done in a gradual fashion.
That's how this thing started a year ago tomorrow. Regardless of what you saw on the screen, obviously that date wasn't correct. That was actually the opening of the first show, which I can say that no one here at WCTV expected that a year later we would still be doing. If you notice the opening of the show, it wasn't even Ask the Doctors at that point. For us, it was going to be kind of a one-off, maybe a two-off, and that was it. So let me start by saying to both of you gentlemen, thank you. It has been a year. This is the 52nd show that we have done together. And speaking on behalf of the community, many people that I know that are watching online have watched in replays. Thank you. You all have given up a year of your time to take questions every Friday in this studio. So greatly appreciate it, both of you.
It's been a real
Dr.
pleasure.
David Jetmore, Wayne County Health Officer. Did I get it right?
Yeah, you did. You nailed it. We were sitting here watching that first show, and the first thing I spoke was, You mildly scolded Eric for his introduction. I think he
That's all
introduced me as the Wayne County Humane Officer or some other.
No, it wasn't that bad. I just added a little something
I
extra.
know. It wasn't.
Dr.
It
Thomas Huth, Vice President, Medical Affairs, Reed Health. The gentlemen, seriously, we appreciate you all's time. I'm curious, when this started, when you all agreed, and I said that it was you all who said, hey, why don't we come in and do this? Can you set up something so that we can answer some community members' questions? Did you all think that we would still be doing this a year later?
Well, for my part, no. I have to say, well, I'm not good at predicting the future anyway, but that particular future, I thought we would do it 1 or 2 times, and I didn't think that Ask the Doctors would take on a life of its own, which it kind of has. Now I'm wondering if it'll ever end. I mean, will we do card tricks after the pandemic ends?
No, this will end. Listen, somewhere in this room, there's a plug, and I'm going to pull it. This is going to end.
Well, you know, it's hard to then have imagined we'd be doing it a year later, partly because, you know, you'd think you'd kind of run out of questions at a certain point, and would it continue to add value? But on the other hand, at the same time, we had no clue how long this would last. You know, I think it was only barely beginning to sink in that we're on the cusp of the pandemic of the century. And I think we might have used those kinds of terms then, but I'm not sure we really understood what that meant. And I think there was an expectation that, oh, maybe this will be a month or 2 or 3 months, and everything will be back to normal, and everybody will forget about it. But here we are a year later, and it's still a significant issue. I worry that you know, people have kind of given in or given up on it, on everything too prematurely, because it's just abundantly clear that this is not done. We may be in for another wave, unfortunately. Hopefully that will be mitigated by vaccination and other efforts. We can see that wave potentially beginning around the world. There are places in the world now that are having upticks. The world as a whole is significantly up for the last 5 weeks. Europe is up. They've reinstituted tighter restrictions in Italy, and they're doing so in France and Germany and other places. And in the Western Hemisphere, in the Americas, Brazil is really suffering. They now have more new cases every day than the United States has, which is a real feat. And India is on the upswing. That's really worrisome because India is a huge, huge country, and when they have a growing rate of new cases, they're going to add a lot of cases to the world numbers. So, and then there are multiple states around the U.S. that are having increased case rates. You know, I follow this stuff all the time, and you can. It's a little bit hard to see if you just look at today's snapshot from around the country. But when you realize that we've been as low on average in the U.S. as in the 80s, about 85 new cases per 100,000 in a week's time. Now it's up to about 145. And a couple of states are significantly are really driving it, particularly New York and Michigan. But there are actually a number of states that are having increased case rates. So, you know, I just don't think it's time to declare victory. I've been saying this for a long time, and I realize I'm beginning to swim against the tide a little bit because the governor has said that all mandated restrictions will end on April the 6th. So, you know, you may be stuck with us for another year, Eric.
Okay.
Because if you look, the only point of reference we have is the 1918 Spanish Flu Epidemic. And we call it the 1918 epidemic because that's the year it started, in the late summer, early fall of 1918. But it actually lasted for all or parts of 3 years.
Okay, you just had people hanging their heads on that one. I'm sorry.
Yeah, I mean, I don't know what to tell you. It's the truth of the matter. There's an interesting article in a website called The Conversation, which is actually a bunch of professional historians who take today's topics and give historical correlations or talk about the history of prior events, and not that things get repeated in exactly the same way, but that can point you to how some things may go in the future. And there was just an article this week kind of drawing parallels between the current pandemic and the Spanish flu epidemic. And there are actually many, many things that are the same, including at a certain point when the case levels were declining and so forth, and people suddenly getting rid of their mask and stopping social distancing and going back to the dance halls when they had such a thing, and the beer halls and stuff, and and kind of came to regret it. So anyway, we have repeated something from the very first show, Eric, which is, I noticed when we were watching that clip that I started talking and I went on seemingly forever, and I've just spoken forever again. So that's a great thing to do on the anniversary, right?
It just keeps coming back around. I'm curious, and I'll start with you, Dr. Jetmore. What are a couple of the most important things you've learned about this over the last year? Because it's from the time we started doing this show till now, we've learned a lot about this particular virus, and we won't even get necessarily into the mutations of it, but we were worried about surfaces and things of that nature. Talk a little bit about some of the changes, what you've learned, because there was a lot of, I don't know, we don't know, we're just kind of learning this as we go type things.
Well, I think there were a couple points of controversy when this all began. One of the things starting with masking, and that was there are people today that say that masking doesn't work and this is all a bunch of hokum. And the fact that we basically had no flu season this year, we all went around wearing masks and socially distancing, and no one got the flu. Now that can't be coincidence. I mean, it's not a scientific study, but it shows the effect masking can have on a respiratory disease. So I think that's one of the things that was really brought home. And the other thing that whenever we've watched these patterns around the world, a country will have strict lockdown, social distancing, masking, the disease rate falls. Then they say, well, it's so low, I guess we can abandon this, and the infectivity rate rises again. So I think that one of the things that's really been driven home is the importance of masking when dealing with a disease that's spread by respiratory particles. Then the other thing that we dealt with early on was the virus itself. Many people said, well, what's the big deal? This is just like the flu. We deal with 60,000, 80,000 deaths in the United States every year from the flu. This is the same thing. Well, and it's obvious that it's much more deadly than the flu, and it's a multi-organ disease. Typically when you get over the flu, you're over the flu. Mm-hmm. You're like you were before. But now we've seen people with what may be permanent damage to their lungs, their heart, their kidneys, their brain. So this is another thing we've learned. And dealing with the race for the vaccine, the controversy was, I remember the early predictions, it's going to take us 2, maybe 3 years to get a vaccine for this. And we got this vaccine quickly, but then people said, well, if we got this so quickly, it must have been kind of a slipshod way of getting there. Maybe a lot of important steps were skipped, but they weren't. We've come up with, I think with Moderna and Pfizer, maybe 2 of the most successful vaccines that have ever been made in the history of medicine. We would have been happy with a vaccine that had an efficacy of 60 to 70%. We get one with 2 with virtually 95% efficacy. We've got a third one on board, Johnson & Johnson, that's between 75 and 80% efficacy, which is also fantastic. So these are all things that we had opinions on, we projected into the future. Sometimes we were right, sometimes we were wrong. I remember early on, I echoed kind of Dr. Fauci's idea that we don't need to wear these masks. No one thought how important masking was at the beginning. And I think part of this was due to the fear that the public would go out and buy every mask in North America, and people in hospital, doctors and nurses wouldn't have any masks. Now we know how important masking is. I'm sure I've forgotten several important things. Tom can clean up
I
for
think you
me
hit
here.
the big ones, and I think it's we can be big enough to admit that we early on, before we realized the significance of the respiratory spread, and before we realized how we sort of overestimated the importance of surface spread. We sort of focused on the wrong things sometimes, and that's just human nature, working from a point of not knowing. But the science has clarified things about that. So this is not, I guess from my perspective, it's not about the politics. I don't understand it being a political thing. It really is what appears to be the best thing to do for a situation based on what we can learn from the science, even in its incomplete and preliminary state. And I think it's actually served us quite well. And the vaccine development, you're right, has been absolutely amazing to me. The people who did that, somebody ought to be in line for like a Nobel Prize or something for such rapid development. Somebody's responsible for that. Doing it so fast, and these new technologies, the mRNA technology, and actually that's the Pfizer and Moderna vaccines. That's not really been applied in this kind of way before, though it's been around for a while. And then even the Johnson & Johnson, and the soon probably will be approved fairly soon, the AstraZeneca vaccine. Those are not mRNA technologies, but they're also a cutting-edge technology, let's put it that way, using genetically modified chimpanzee cold viruses to provoke immunity against the COVID-19 virus. And that's really kind of different. We haven't had that before. So really we really are benefiting from living in the times that we do. This thing could have been so much worse if we didn't have the epidemiological, savvy. We didn't have the virological science, and the vaccination science is really, I think, this pandemic could have been worse than or as bad as the Spanish flu in the early 1900s. It's not going to be that bad, and it's because we are blessed to live in such an advanced scientific period. So, but that should be reassuring. But I think that there are also aspects to pandemics where that we don't completely understand, and so that makes them hard to predict. And that reminds me, I was thinking about the early on, we had these predictions of what the epidemic curves would look like with masking and distancing, without, and so forth. And I remember I think it was the University of Minnesota's was a highly respected projection out into the future, but the pandemic has not looked like any of their projections. And so I think it shows that we still need to be humble enough to realize we don't know everything.
You're watching Ask the Doctors on Whitewater Community Television's WGTV Channel 11, WCTV Channel 21, streaming on Facebook Live. We are taking your questions on our Facebook page, as we have for the last year, as well as on Twitter at WCTV Info. Before we go there, I want to turn back to Dr. Jetmore and say you all have a J&J vaccination clinic tomorrow. The goal was to try to get at least 500 people. That is from 11 until 5. You can still register for an appointment, ?
No, I don't think you can. I think all 500 of those appointments have been used. However, we
however.
we secured some more vaccine, and so we'll still accommodate people that are walking in. Now, I don't know how long we can do that. So we're going to start at 11 o'clock, and we'll finish at 5. So like I said, we've got 500 people that are scheduled, but we will take walk-ins, and I would advise people to get there earlier rather than later. I think it's going to be problematic if a bunch of people show up, shortly before 5 o'clock walk-in. So this is your chance to come down, be vaccinated with a great vaccine. It's a one-shot vaccination, so it's a one and done. When you leave there, you'll get a card, you'll be fully vaccinated, you'll be totally at the correct immunologic level 2 weeks after that injection, and that's great. And it'll jack up the percentage of vaccination in our county, which will make us all safer. So I'm pretty happy about that.
Okay. It's tomorrow, 11 to 5, former Elder Bierman Building, 601 East Main Street, downtown. Dr. Jetmore is going to be giving shots.
That's right.
Dr.
Brad Barrett.
Representative Brad Barrett.
Yeah, Brad
and
will be
his
there.
wife
Brad's
will
wife,
be there.
Mary Ann, she'll be there.
Giving shots.
I'm sure there'll be a long line in front of Mary Ann and a shorter one in front of Brad. I don't know how you get line envy there, Eric. It's terrible.
I don't know anything about that.
Everything's a competition with these people.
You all, no, I'm not going to travel that road with you, but thank you. And before we get to some questions, a couple of days ago, the governor has decided that he will open up vaccinations for everyone 16 and above as of the first of the month, I believe, is when it's going to start, which means the assumption is that both of you all, I think, are expecting an influx of more vaccine into your sites, because one of the things that you have both said over the last 4 or 5 weeks at least is that you could be vaccinating more people, you just don't have the supply. So are you all promised the supply? Are you expecting it? Do you have a feel as to when it's going to hit, or is this just kind of a, okay, they're going to tease?
Our supply situations are really a little different, and it just, I don't, that we don't have the same routes of supply, let's put it that way. Reed actually happens to have quite a bit of vaccine. In fact, we don't really need another shipment probably for several weeks.
Okay.
And but that's partly because we have Pfizer, and that's pretty much it. We had a small amount of Johnson & Johnson that we were thinking of using for special projects, and we've contributed the majority of that to the health department for tomorrow's clinic, so that it can go ahead and get used. But I'm requesting more for some other special projects. But that's not something we will have at the Kuhlman Center in all likelihood ever. But because there's a much larger supply of Pfizer vaccine in this state, we happen to have quite a bit, enough to last several weeks, like I said. And that's a little different than for the health departments who typically get Moderna. And I know that's what you all get, and the supply situation's a little different for that. And of course, the Johnson & Johnson is in the least supply of the three. And so it's hard to get a whole lot right now of Johnson & Johnson. But there's also a difference an age difference in what they're approved down to. I think for the Johnson & Johnson and for the Moderna both, the lower age limit is 18, I'm pretty sure. I know it is for Moderna. So even though the age eligibility will be down to 16 as of next Wednesday, that doesn't mean you can just get vaccinated any place, because we were only able to use the specific products within the age ranges specified in the emergency use authorizations. For Pfizer, that happens to be down to 16.
Okay.
So really, if you have teenagers 16 or above that you want to be vaccinated between 16 and 18, then the place to go will be to the Kuhlman Center. We'll have plenty of Pfizer for that purpose.
Your vaccine's in good shape. You're expecting some more. You'll be ready to go.
We've been getting more supplies every week, and we've used all the vaccine we've gotten of Moderna. It's like Tom said, it's only approved down to age 18, so people between the ages of 16 and 18 only have one choice. They've got to get Pfizer. I might add that all of those drug companies are doing drug tests on younger people all the way down to infancy. And I think for this truly to be over, we need to get all of those people 16 years old and under vaccinated. Yeah, I think that the whole goal here is to get everybody vaccinated. I think initially we got 400 doses a week of Moderna. Then it was raised to 500. Now I think we're up to 800, and we managed to get we've not wasted a dose yet. I'm very proud of that, and that's due to Christine and the vaccinators down at the clinic. They've done a fantastic job. Kudos to all you guys.
And the other question that I have to ask before we go to our questions, and a year later, you all are still generating plenty of questions, so the voice in my head says we got to get to those pretty quickly. The governor's lifting the mask mandate as of April 6th. He is allowing counties to do what they feel like they need to do. Any feeling as to where this is going to go here locally?
Well, the governor has basically said that masks are not mandatory after April the 6th, which is, I don't know how he chose that date. I don't know of a single epidemiologist in the United States that's saying, wow, this is great that we're getting rid of masks and social distancing. This should really help. But I'm sure there are political pressures that are being brought to bear on the governor that are not being brought to bear on me as a health officer here in Wayne County. But having said that, you know, he made the statement the other day that the positivity rate's down to the level it was last June, but he didn't lift the mask mandate last June, so that makes you kind of scratch your head. Most people are fearful just based on experiences here in the United States in different states, and based on experiences looking at Europe, Asia, South America, that when these mask mandates are lifted, we talked earlier about how effective masks are, the infection rate goes up. And now we're dealing with variants that are much more, not necessarily more lethal, but certainly more infectious. Some people say that with B117, which is the only, I admitted to Tom earlier, is the only vaccine I know the numbers and letters for, they say that the number of people infected with that particular virus doubles every 10 days. So that's an amazing fact when you think about it. But the governor said it's no longer a mandate, but he and Dr. Box advised people to continue to wear masks. But to me, that's a little like saying, we used to make you stop at stop signs, but now it's just advisory. Well, you know, a lot of people are going to be going through stop signs, and I think we're going to start to see a lot of people without masks. I'm going to continue to wear a mask. I think it's a courteous and smart thing to do. I mean, I've been vaccinated, but I just think, you know, here's the thing, you know, here's how we should be thinking. When the infection rate, the positivity rate's 16 to 20%, the hospital's full, all the ICUs are being used, we should say, hey, we need to wear masks and socially distance and try to get vaccinated. And when the positivity rate is 2%, we need to say, hey, this is working. We need to keep on wearing masks, socially distancing, and keep on getting vaccinated. We've got to drive, you know, we're still seeing, you know, a fairly large level of deaths on a daily basis and infected rates in the United States of America. And it's not, this disease isn't like the flu. You get over the flu, you're back to where you were before you got the flu. This disease, and we're going to be finding out about this disease, Tom, I think for years from now as they study this. But this is a multi-organ disease, and people may be left with permanent disabilities from having this disease and having survived.
Mask mandate actually does still apply. If you go into a state building, you'll still have to wear a mask at that point. So it's not completely going away. Let's take your questions. Facebook as well as Twitter at WCTV Info. We've got some time. Let's get to your questions. With the single-dose J&J vaccine, are we to assume more and possibly stronger side effects?
No, I don't think so. I haven't looked at the research on this, but I don't think that that's an assumption that someone has to take if they're going to go down and get the Johnson & Johnson vaccine, that they're going to have more side effects than the Pfizer or Moderna vaccine. And these side effects are capricious. I mean, why does this one person have a sore shoulder and another person, my son got it up in Detroit, and he had chills and felt just kind of felt weak for a day. That was a Pfizer vaccine. Have you seen any literature, Tom, on differences in side effects from J&J versus the others?
I'm not aware of any significant difference, comparing one shot of J&J to one shot of something else. I'm not aware that there's any reason to
Maybe the
expect a
questioner is
different
asking
experience.
because you're just getting one shot that it's somehow more potent and you're
Yeah.
more likely to have side effects.
I guess
No,
that's right.
I don't think that's the case.
Right, no.
Okay. Next question. How important is it that if you have side effects beyond flu-like symptoms and sore arms that you report the side effects? If we should, who do we report to?
Well, that's a good question. It is important to report side effects now. The best way to handle this really is to make sure when you get a shot to sign up for VSafe. It's done through texts, but once you sign up, they'll send you periodically a link to go to report. How am I feeling? Have I had any specific side effects? To me, that's the way to do it. But if you also bring it to the attention of your own healthcare provider, family doctor, or whatever, they can make a report to the Vaccine Adverse Events Reporting System for it. And, we have made a number of reports like that, even when we weren't sure they were really necessary. So we tend to err on the side of reporting things, even if, having a low threshold, let's call it, for reporting things. So we can do that. Any healthcare provider can do that. And, but like I said, the easiest way is to use VSafe.
Okay. Let's keep going. With good news about our numbers, both in vaccinations completed and low rates of COVID-19 cases here in Wayne County, how do you see this enabling us to resume the fine arts here? And obviously, you've got places where people would have to get out at the Symphony, Civic Theater, Civic Hall Performing Arts Center. How do you see that shaking out as many of them right now are beginning to look at what would be their upcoming fall seasons?
Well, I feel pretty sanguine about things being in good shape for the fall season. And I guess I'd have two different answers. I guess one is right this minute and in the fall. There's, these vaccine makers are tooling up and making more and more vaccine every day. In fact, I saw in the newspaper the other day that it's thought that we're going to have a surplus of vaccine, and our government's going to have to make a decision about whether or not we want to share this with other countries, which obviously we should, because everybody on earth needs to be vaccinated. But having said that, I think I'm hopeful. And I'm hopeful that I'm right, that positivity rates, will be, it needs to be fall and stay below 1%. I've heard that number quoted by a lot of epidemiologists. And I think that well could happen in the fall. The one wild card is, as we've seen this vaccine open up to younger and younger people, we've seen less and less people in those age groups participate. That's kind of disquieting. Now, on the plus side, last fall, 44% said they wouldn't get vaccinated. Now that number's down to 30. Hopefully that'll fall even further because we need a large group of people to get vaccinated to stomp this out completely and to reach the so-called herd immunity. Now, as far as putting on a show tomorrow or this week, that's a lot more problematic. One of the basic problem is any endeavor where you have an audience, and we've seen this, whether they've gathered to watch a ballet or a baseball game. All of these seats, typically are cheek to jowl. There's a guy sitting here and a guy sitting here, and so it's very hard to gather up an audience and maintain social distancing. So you've limited your, and then in some shows like musicals or large cast dramas, you've got to protect the people on the stage. Now, one of the things we can do to combat this, at least in terms of the performers, we can tell these people, especially once this is opened up to everybody, let's all get vaccinated. If you want to play in the symphony, if you want to perform on the stage, if you want to sing, get vaccinated. And that's another benefit besides not getting COVID, is the fact that it's going to make everything much safer. I don't know, I don't have a detailed plan for whoever asked that question. I'm sure they'd love one for me to pencil out exactly how they should proceed, but I think we can do that now, but I think it'll look a lot differently in the fall. I think it'll be a lot closer to the way it was.
That's encouraging. You're watching Ask the Doctors on WCTV. Channel 21, WGTV, Channel 11. We're speaking with Dr. David Jetmore, Wayne County Health Officer, Dr. Thomas Huth, Vice President, Medical Affairs, Reed Health, taking your questions on Facebook as well as on Twitter. Next question up. Is it safe to fly after 2 doses of a vaccine and wearing a mask?
Yes. That's assuming 2 weeks have passed after your second dose of the vaccine. Now, is it safer than sitting at home by yourself? No, there's always an element of risk. Well, there's an element of risk flying before the Covet epidemic. But the circulation systems in planes is much better than we thought at the beginning. I learned a lot from this, as I'm sure both of you have, that you're very unlikely to get, and we saw this during the pandemic. We've not seen any big outbreaks in planes where somebody was going somewhere in a 747 and 100 people got infected. We've not seen any stories like that. Once again, that's anecdotal evidence. But it turns out the circulation of the air in the plane is exchanged very frequently with the outside atmosphere. The big problem with traveling is how you conduct yourself in the airport. And I've flown twice this winter. I hadn't flown in a year. And I don't think I would have done that had I not been vaccinated. But the airlines are very cognizant of this. There's an empty seat between you and someone, so you're not sitting cheek to jowl with somebody on a plane. People are wearing masks. I felt it was a pretty safe experience.
Next question. Can you explain mRNA technology in layman's terms so people can understand that their DNA is not altered by the vaccine?
Well, let me take a shot at it.
This is in your wheelhouse.
And then Dr. Jetmore can...
I'm going to set my clipboard down because I want to hear this.
Can even narrow it down to...
Now, we want this in
clearer
layman's terms, Tom.
Okay, I'll try. But unfortunately, I do have to have a little bit of familiarity with the science involved, which is when we think about the cell in the nucleus, we have our DNA, right? That DNA encodes all of our characteristics, and importantly, it's basically the hard drive, the long-term storage memory for the directing the cellular processes to make the cell work. But it communicates to its mechanisms via basically a small molecule called messenger RNA. That's the normal process. That's the messaging molecule from the DNA to the cellular machinery. And what the mRNA vaccines do is they have pre-made synthetic messenger RNA that's encapsulated in a small lipid nanosphere, it's called, that allows it to diffuse into the cell and message to the machinery directly to produce the spike protein on the cell surface, only very temporarily, because the cell also has enzymes that break down that messenger molecule. Now, when we talk about the vaccine technology, we give the shot, it introduces the mRNA directly, causes the machinery to produce the spike protein. You'll notice in that explanation, that has nothing at all to do with the DNA, the genes of the cells. We're bypassing the nucleus completely. And that's how to understand that we don't actually have, not only don't we change anything to do with the cell's genes, we bypass it completely with that system. So, you know, I've searched and searched for a great graphic that's kind of helps in a glance for the people who don't have the technical background to easily grasp this concept.
Like me.
But I hope that the way I've just described it helps. Now we'll turn to Dr. Jetmore to get the true kind of folksy, how the cowboy out on the range
I'm the folksy
would
one, huh?
understand it.
Okay,
That
well,
tied up the burro
I'll wear
outside.
that. I'll wear that mantle. I think that was a great explanation that you gave, Tom, and I mean that sincerely. And just to finish out your great explanation, now the cells made these spike proteins, and they're released from the cell, all these spike proteins, and the immune system recognizes this, and that these spike proteins are the enemy, and they make antibodies against those spike proteins. So once you're fully immunized, when a coronavirus enters your nose and tries to attach with those little spike proteins, your body recognizes that and attacks the coronavirus. A bloody battle ensues, and the immune system wins.
Great death and
I
destruction
wanted
on
a
both
little
sides.
drama. I wanted a little drama. In the,
And then you feel better and you take your pangolin out for a walk.
that's right.
There you go. You're watching Ask the Doctors on Whitewater Community Television's WGTV Channel 11. Also, on a previous episode of In Focus, Dr. Peter Blair, who was also a guest here, came with a model that he talked about this also. So you can watch this episode again, or you can go to WGTV online and you can find that In Focus episode. And yeah, we've got a couple of really good explanations of that.
The bottom line is your DNA is not touched in any way, and you are the same as you were before, except you're immune to coronavirus.
Marvelous. Around this time, we have about 10 minutes or so left in our show. We asked Dr. Huth to give us an update on some of the numbers that he's seeing in Wayne County, so we're going to go to that right now.
Sure. Okay. Well, we should be getting used to seeing this by now. This is the Wayne County data, weekly case numbers, and way down in the right-hand corner, we can see that I'm projecting we'll have about 44 cases for the week, which would have us flat in this county, maybe slightly upticked, but not much. I would call it flat. Up on the left-hand side, there's the insert that is a little bit of a technical description of the deaths. You know, I've colored this green again, Eric, because we've had more cases but no more deaths in a couple of weeks, actually, several weeks in Wayne County. And so the ratio of deaths to cases has dropped down just below my yellow zone cutoff of 95%. So in other words, we're at stand now at 94% of expected deaths, and that's good. That's actually a bit of a drop. The next page, guys. I haven't showed this one in a while. Basically, this is by quarter. So basically, there's a 3-month periods of time. We're in the first quarter of 2021. I'm just about at the end of it. And these are the proportions in the different age categories. I've added some yellow or some blue arrows to show that from the fourth quarter of last year, which ended on December 31st, to now. Basically, we've had an increase in of the cases that we've had. They've been lower, obviously, but the ones that we have had have actually a higher proportion in the under 40 age, all of the under 40 age groups, and lower in the over 60 age groups, which is a very good sign, and which is kind of, it goes along with the fact that we've had more cases, but really no more deaths recently, and it's that we've had a lower proportion in the upper age groups, which is the biggest risk factor for death. So these are positive. These are good. Next page, guys. And these are the read stats. Just the general gestalt is the important thing. We can see clearly the 3 waves that we've experienced here. I think you can see it here more easily than you can in some other data sources. In this current week underway, we've had an average of about 10 people in the containment zones. So that's actually still on a bit of a downtrend, so happy with that.
Okay. We've got about 5 minutes left. We're going to see if we can get 1 or 2 questions in. So we're going to do that, and also at the same time remind you they are taking walk-ins for the Johnson & Johnson vaccine clinic tomorrow, but Dr. Jetmore is suggesting that you walk in earlier rather than later in order to be able to do that. But they are not taking any more appointments at this time because the 500 appointments that were available have actually been taken. So let's see if we can grab a question or 2 before we get out of here. A friend passed away recently after having COVID. Is there anything we should know about being in her house and handling her belongings?
You know, we used to have a lot of discussion about how long does the vaccine or the virus hang around on surfaces and so forth. I think the reality is you don't need to worry about any of that. You know, I've never heard of anybody getting infected from COVID-19 from handling somebody's belongings.
No, I remember a year ago, Tom, we talked about people were asking if they ordered something from China,
Right.
you know, should they use tongs to unwrap it, or, and this fear was overblown. We were just learning then about the virus, so I wouldn't worry about handling the belongings of someone that had COVID.
Okay. Next question, maybe our last one for this week. We'll see. Should contact lens wearers take any special precautions to prevent COVID-19 infection?
I don't think so.
From the hip answers, no. Are you thinking that, you know, we talked earlier during the vaccine a year ago, we were talking about if you touched the surface, you rubbed your eyes, tears carried the COVID into your nose. But I don't know that contact lens wearers would be any more susceptible to getting COVID as non-contact lens wearers. Now, I say that with the caveat that Dr. Hughes may have read or heard something different.
I have not, and so I would agree completely with you. I was just trying to go back through my memory banks. What have we said about vision and so forth? The only I can think is that there is some evidence that people who wear glasses may have a little bit lower rate of coming down with COVID-19 after being exposed, but I've never heard of any association with contact lenses. And so I think if you're using if you're doing your standard technique, cleaning your hands and so forth before you handle your eyes, you should be fine.
And That's obviously still important. The hand hygiene, social distancing, wearing a mask.
Yeah.
Okay. Gentlemen, you're down. I'm not going to say a year to go. Let's say we've got let's say we've got another 3 months to go, and we'll go from that point. How about that?
Okay.
Definitely appreciate you all being here and continuing to do this. Dr. Thomas
pleasure.
Huth, Vice President, Medical Affairs, Reed Health. Thank you. Still
pleasure.
doing your Wednesday evenings?
I am still doing Wednesday evenings, Channel 7 in Dayton, WHIO. A lot of fun. They're very nice to me, and I appreciate that. I also do little guest Zoom interviews for different outlets. Channel 7 also, one of the stations in Indianapolis, calls from time to time. I haven't been on MSNBC or NBC or any of the national ones lately, so I was hoping you could do something about that for me, Eric.
We'll see what we
with all
can
your
do.
contacts in the industry.
See what kind of poll I've got? Okay. Dr. David Jetmore, shot giver extraordinaire tomorrow. We'll see how hard
That's
his
right.
arm works tomorrow.
I've been working out, trying to get in shape for giving these injections.
Okay.
I think I'll be able to last.
Wayne County Health Officer, thank you very much, gentlemen, for being here. We really do appreciate your time.
It's a pleasure.
Couple of things that are happening in the community that we do want to remind you about. There is a drive-through egg hunt tomorrow. I don't think we're going to need that rain date. I think we're going to have a good time tomorrow. This is with the Richmond Parks and Recreation Department. Glen Miller Park from noon until 3. It's a free event with prizes. Sunday, March 28th, 7:30 to 9:30, there is the Worm Moon Full Moon Night Hike.
Okay.
This sounds like right up your alley, Dr. Jet. I mean,
Yes,
it
I
does.
love night hikes. But I
Copen-
don't understand the worm moon thing. Is that, will they be collecting worms? Or
I
will
can't
there be
tell you. Listen, I only read them.
I thought you did extensive research before you made these announcements.
Oh, no. CopeEnvironmental.org if you need more information. Green Thumb Thursdays are happening at Morrison Reeves Library, April 1st, 8th, 15th, 22nd, and 29th. Things like soil, worms, plants, dealing with diseases in pets, and starting seeds indoors. It's spring. Get out and enjoy the wonderful weather that we are having. We will be back next Friday, 2 p.m. for another edition of Ask the Doctors on Whitewater Community Television's WGTV Channel 11, WCTV Channel 21, and streaming on Facebook Live. As always, we appreciate you watching. You can see this show on our Facebook page if you've missed any part of it. Thanks for watching. I wish you well. Have a great weekend. This episode of Ask the Doctors has been brought to you by Wayne County Government. The Wayne County Health Department is holding a COVID-19 vaccination clinic this Saturday, March 27th from 11 to 5 at the former Elder Beerman site, 601 East Main Street. This will be a J&J only vaccination clinic, which is a one-dose vaccine. Dr. David Jetmore, along with State Representative Brad Barrett and his wife Mary Ann, will be part of the team giving shots. You must be an Indiana resident who meets current state eligibility guidelines to participate. Appointments are preferred and can be made at ourshot.in.gov, but walk-ins will be accepted.